In today's health headlines, what to know about the new COVID variants. Monkeypox cases are rising in New York City, and the tuberculosis outbreak has now been declared a public emergency in a U.S. city. Joining me is Dr. Onyema Ogbuagu, Yale Medicine infectious diseases specialist and associate professor of medicine at Yale School of Medicine. Welcome.
Thanks for having me, Ann.
All right, you're the authority. The COVID virus has mutated into a new set of variants called FLIRT. What should we know about this?
Yeah, thanks, Ann. I'm not sure if anyone's still following, the variant evolution of COVID at this point in time. But yeah, FLIRT is an acronym that relates to the mutations in the spike protein of the virus. And I think what we've seen historically with emerging variants is that they become more immune evasive, such that the immunity that are generated from prior infections or even like the booster vaccines that were received may be a little less active against the variant. But the good news is that so far it doesn't appear to be causing much more severe disease because a lot of us already have immunity from prior infection or vaccines. But the point I would want to make is that we need to continue to monitor these variants, and it's going to change the way we design vaccines for upcoming seasons. We already have a new recommendation for a different COVID booster to be produced for the upcoming fall season in 2024. And also, just to highlight again that these variants pose a threat to individuals who are older and immune suppressed. And so that's a group that, in spite of vaccine history, are the kind of patients we're seeing in the hospital. And the last thing I'll just want to say is that the way we track these variants are really from tests from those who test positive. And we've seen a decrease in the number of testing that people are doing, outpatient. Sometimes people feel sick and they're not testing. We need those tests because that's how we generate the data on emerging variants and monitor that.
Sure. All right. New York City is seeing dozens of monkeypox or mpox cases every month. What is behind the surge?
Yeah, so we all know that what happens in New York frequently comes over to Connecticut, and I think that's why that's important. And New York Health Department is warning that they've had more cases in the first quarter of this year than they had all of last year combined, with up to 50 cases occurring in a single month. For example, Connecticut's not too different. There've been more cases in the first quarter of this year than they had been all of last year. So again, the caution is that mpox continues to spread in the community. It appears to be acting like a sexually transmitted infection, occurring more among minorities, so Black and Hispanic men or sex men within the 25 to age 44 demographic. And also, important point here is that there are vaccines to protect against mpox, and we're seeing that almost 3/4 of those cases are occurring in those who are unvaccinated or those who received only one of the 2-shot vaccine series. So I think it's something that all providers should be aware of.
And finally, a tuberculosis outbreak in California resulting in 1 death and 9 hospitalizations is now declared a public health emergency. What can you tell us about this?
Yeah, and that's data from Long Beach, California. So just to reassure everyone, tuberculosis in the U.S. tends to be a disease that we see more in immigrants into the country. Local spread of TB tends to be very limited. But, in the Long Beach example, it was a hotel where a lot of people were living in the same space. Tuberculosis is transmitted through the airborne routes. And so it makes sense that they had a couple of cases. And, individuals who are experiencing housing insecurity, people who live in clustered environments, history of substance use are vulnerable to the infection, and especially those with immune system as well, immune compromised conditions as well. So I don't think it's something that we need to lose sleep about at this current time. And I think that was a local outbreak, and the health authorities are responding to those who got exposed.
All right. Thank you so much, Dr. Ogbuagu. Have a great Friday.
Thank you.